the advent of technology, which has changed from the earlier days when we were talking about just prevention. And in the next 15-20 minutes, I will cover some of these areas. It's a very vast topic where I'll give a gist of what are the possibilities rather than going deep into what technology is doing. And then, of course, if there are any questions after that, we could take that. So thank you very much for coming. And so if you look at this photo, this is starting from the cradle up to the time of our death. They say that it's possible for us to look at technology and be proactive. So at any age, any gender, any situation, we could be proactive and we could actually be doing preventive medicine rather than looking curative. So between this time, what are the possibilities? So what has actually happened is that even though I showed this photo, it has actually gone even prior to that. So when I show you the next photograph, you will see that even before the cradle, we have now ways in which proactively we can prevent and interfere and produce good health. So we all know about the amniocentesis, where we could take out the amniotic fluid, look at the possibility of any illnesses in the child, and then look at ways in which we can do something. And the next photograph in that shows what is a very new technology. The spelling is wrong. It is CRISPR technology, where it has been now gene editing is something which is coming into the picture, where if there is a specific genome and there is some defect in a specific area in your DNA, it's possible to interfere and you can correct that. And that is something which has actually revolutionized the proactive medicine to such a level that even before we are born, it's possible for us or people to see that how a very, very serious illness in the future can be actually prevented. So that is something which is a big jump in the area of healthcare, where fetal medicine has become a major area of focus, especially with the focus on CRISPR-like technology, where we can interfere. Now, this is a beautiful picture which many of you might have seen. This small hand which you see here, the one which you see there, the small hand, that is actually the 21-month-old fetus holding the hand of the surgeon who was doing a surgery on a fetus which had spina bifida. So the fetus had spina bifida, which was diagnosed during the fetal screening, and it could have been one of the major problems as the child is born, and then they decided to go in and correct that. So while doing the surgery or towards the end of that, when the uterus was opened, they did something like a mini cesarean, and by the time the surgeon, Dr. Berner, was trying to close the suture, the small fellow very lovingly caught the hand of the surgeon, finger of the surgeon. This is a very famous medical photograph where a fetus holding the hand of finger of a surgeon, showing us the capability that we can interfere even intrauterine, even help people or help fetuses or children. He is a very healthy boy now at the age of 21. He is a very healthy boy. So this is something which is really giving us that through technology, through proper methods, it is possible for us to be proactive rather than reactive once that child is born. This, I need not tell you who this is. You all know, and she is one among the most celebrated faces
Angelina, right?
in the history of
She's in that
cinema.
B-side?
And most of you must be knowing the story about her. She had a mother who died at the age of 56 due to breast cancer, and there was a family history of cancer breast, and she decided at the age of 38 or so to check for the gene and found that she is positive for the gene BRCA1, which predisposes Angelina Jolie for a breast cancer to occur, 86% chance of getting a breast cancer, and 56% of getting an ovarian cancer. So very boldly, with the support of her most loving husband, Brad Pitt, she decided to do a bilateral mastectomy to prevent a cancer occurring in later life. That is something, and she came out and told that. She is somebody who is a celebrity, and the trauma of having a surgery and announcing that didn't prevent her from doing that. And that is real proactive treatment which helped us. We know that she is very healthy, and we know that she will remain like that. That shows us the value of proactive treatment which can help us to prevent something which otherwise could have taken her life away. So this is a very shining example of proactive treatment by way of proper diagnosis. Now, coming to the present day, all of us are now wearing lot of wearables like Fitbits or the Apple Watches and patches, and it's said that there are hundreds of thousands of wearables in the internet as well as on the app stores which are being used by many people. And this is something which is really helping for us to be proactive in taking care of our health. Instead of being reactive, we are proactive and knowing something before it is happening. The Apple Watch, the new one which came out, has got a ECG screening method by which you can record your ECG, and also a SIM card through which you can send it to your cardiologist. In case you feel that there is a problem with your chest, you have a chest pain, and you suspect that there is a possibility of a cardiac problem, you could immediately do a ECG and send it to your cardiologist, who can decide. There is a central monitoring station, and then they can decide whether there is any problem and get back. Like that, there are many patches. It is not only the cardiac problem. In so many other areas, you have patches now available which actually helps us to find out before something happens and take the preventive measure. This is real technology which is helping us to avoid possible catastrophe and helping us to keep ourselves healthy. Now, this is again something which is automatic medication based, automatic medication administration based on monitoring. You all must be aware about many diabetic patients now using such gadgets for delivering the correct dose of insulin to them, and that is actually giving them the best possible diabetic control instead of having an insulin dose either in the morning or evening or taking tablets. If you can have a monitoring of your blood, and if that can help you to have the correct dose of insulin being delivered, that is real technology which is helping you, and this is becoming more and more popular controlling diabetes. So this is another very, very important thing which is going to help us. Now, this is something which is helping the older people. Now, we all know that there are a lot of people in the world, as the world is aging, especially in the advanced countries, large number of people who are left at home and who may not have anybody to take care of them. There are sensors now available which is kept all over the house, including on the bed where they are staying, lying down, and the way in which they are walking in the home. All the sensors detect their normal routine, and if there is any change in their routine, that is being monitored by the sensor, and this is sent to a central station from where immediately intervention is taken. Either the patient is contacted and asked to do the necessary intervention, or an ambulance is rushed, or the preventive measure is taken. Sometimes even the patient may not get up from the lying position in the bed, even during the normal time when he is expected to get up, which is a very, very serious thing. Or there may be even the gait difference, the way in which a patient is walking, if it is not in the normal way. These are all detected by the sensors in the home, and that definitely gives that opportunity for the doctor or the people who are monitoring to take up the case and act. With new technologies like Alexa and all, you also have the advantage of even the patient, even if the patient is not able to move, even shout or make noise and call the attention of the people who are taking care or monitoring. This is a big advantage when you look at the nursing homes or other places where old people have to be kept. Instead of that, they can be at home and can be always monitored, and whenever there is a necessity only, they are being given the treatment. This is a major thing which is happening now. Now, this is something which I just want to highlight. So, we all know that there is a shifting from the acute episodic care or reactive model to a proactive and preventive model. So the most important thing here is that you have to understand that, first of all, it is possible for somebody to get a view whether you have a problem. How is it possible? Genomics have gone into such a level that within a short period, all of us will be able to get our genomes tested, and we will know what are the risks that we will have in our lifetime. It's said that as a child is born, if you just test the cord blood of a child, you must be able to tell whether this child is going to have, maybe at the age of 60, this child is going to have a cancer, or at the age of 50, this child can have a heart attack. It should be possible to tell as we go forward. It has not gone to that stage, but this is what is called predictive. Through genomes, we can predict, looking at the family history as well as what the genome and the environment, we can predict what somebody is going to have and provide the advice as well as the treatment as is required. And this proactive model is what we all want. As we go forward, we hope that within short period, we will have ways in which we will know what are the risk factors that we have, what are the things that we should be taking care of, and what are the ways in which we can make sure that we don't get something without proper warning. So this is something which the world is moving forward, and I'm sure that within a short period we will reach there. This is just to give you a view on small things that we have started in Aster, where we thought that we also have to do something where preventive or proactive measures can be taken through technology. One of the important things that we have done, and which we are actually now from the test model going into the actual clinical model, is the home monitoring of diabetic patients for chronic diseases like diabetes and hypertension. We have a platform which can very well take care of these patients. Their blood sugar, their blood pressure and other parameters are automatically read by the machines and fed into the central station, which is being monitored by people sitting and watching that. And whenever there is a change in either the blood sugar or the pressure, and there is a requirement for intervention, the patient will get a call and the patient can come to the doctor, or he or she will be advised what to take care. And this is something which we think will produce a huge change in the management of lifestyle diseases. As we all know, we have huge issue of lifestyle diseases in this country as well as world over. And if we can control diseases like diabetes and hypertension through technology more effectively, rather than once in a month or once in 3 months the doctor seeing the patient, and that also taking such long time for the person to come to the doctor. If we can do it in a much more effective way, keeping the patient at home in the comfort of the home, if we can provide this, there is no better way in which such lifestyle diseases can be addressed. Like that, another very important thing through technology that we are now undertaking is to do mass screening for women for breast cancer. We all know that breast cancer has been a major issue in women, and unfortunately women are reluctant to undergo screening in the hospitals because of many reasons, including the lack of privacy and the radiation and many things. So we have recently gone into partnership with a company in US called the iBreast, who have supplied machines which are not having any radiation effect, and it is through the ultrasound technology, and it can be very easily done, and this can be done even by very minimally trained people. There is no requirement for a radiologist or a radiographer to do this. It can be even by a paramedic or even a trained person. They can do that. So this is again technology which will help us to detect much earlier any possible lump which could be cancerous and which can lead to death of a person, because breast cancer, as you know, is one of the biggest killers among women, and this has to be addressed properly. I don't want to prolong. As I mentioned earlier, just to conclude, I just want to say that we have to be shifting from the reactive to proactive care, and the treatment has to be personalized, and personalized treatment is possible once we have the genomic knowledge. Once we have the genome of each person, which is now being done even at a cost of $100, the total genome can be actually analyzed for just $100. And if we know what the person will actually react to, or which medicine is acceptable for a person, that is going to be a personalized medicine depending on that person's genetic trait as well as his overall body composure. The other one is, as I mentioned earlier, predictive, because you can predict whether somebody is going to get a problem and take precautions like what Angelina Jolie did. We could predict and take precautions for that. The next one, of course, is the preventive, which we usually do, like in case of the diabetes monitoring and things like that. And the most important one is participatory. There has to be the participation of the patient, the caregiver, and the whole system for something to be successful for such an approach. I thank you very much for the patient hearing and will be happy to answer any questions. Thank you very much.